Okay, so first I have my bag here. This is normal saline. It's not expired. It's clear, right medication. I've already spiked the bag with the drip chamber half filled. Going to make sure that there is no air in the tubing. Alright, I'm getting water. There is no air in the tubing anywhere. I am now going to attach the tourniquet and cut my 4 pieces of tape before venipuncture. And I'm going to cleanse it with outward circles with an alcohol prep wipe. And I'm going to make sure that I have my equipment with me as well, including the IV tubing and the IV catheter. And then I also have a syringe here of normal saline. And then I have my quote-unquote patient. Now I do have my BSI on, and I have my sharps container for after the venipuncture. Now I have my 20 gauge catheter with the bevel up, repalpating the vein, and this has dried during the time, so I can now puncture. I have my IV tubing connected, so now I would take Tegaderm and cover this with Tegaderm, and then use the tape, and I'm going to open back up the flow just to make sure that it is flowing. Okay, so it is flowing. The IV is patent. So next I'm going to move on to the IV bolus administration skill. So I'm going to ask the patient for any known allergies. I'm going to assemble my pre-filled syringe. No air bubbles. Normal saline, not expired, no contraindications, and it's clear. I am going to attach the needle. Oh, I should have taken off the tourniquet, which isn't actually there. Uncap the needle. I'm going to cut off the IV flow. Put the needle into the closest Y port and injecting at about a medium push rate and looking for any adverse reactions or side effects as I push. There were none noted. I am restarting the IV flow. Sharp in the sharps container. Other sharp in the sharps container. I should have done that earlier. And I'm going to continue observing the patient for any adverse side effects. And I believe I'm done.